me. I'll just not take a very long time, just 4 or 5 minutes. I'm here to introduce Dr. Savita Bastavadi, madam, and Mr. Keval Arora ji. Both of them are AI experts, artificial intelligence, and Mr. Kamal Arora ji has spent almost more than 10 years in US working on AI. Madam has also got extensive experience in AI. So I was just talking to them and was requesting them that in the morning I was just touching upon artificial intelligence, and they have got a lot of projects on which our students can work with them, and even our faculty can work with them. But I told them that let us take a one project as a some sort of a pilot project on which our faculty also works and some of our students who have done well they can work, and this we can present in the international conference next year, the same conference which will happen in October 2026. Now what is the project is that most of our the faculty who sits in the clinical OPD, they are from south, and our patients are Bhojpuri patients, so they don't understand Bhojpuri, and what they speak, Bhojpuri patient doesn't understand. So there is a huge communication gap because of which our OPD is slightly on the lower side. Now, how to bridge this gap? You would have seen when Dr. Tomar comes, his OPD is 120 because he can speak Bhojpuri. He can connect with the patient. He will ask the patient about his father, mother, children, how everything, because he can very fluently, effortlessly speak that language. But our people who are from South, the clinical faculty, they cannot connect with the patient. And here in India, connecting on one-on-one basis is very important for the patient to come as a repeat patient. So now, Madam Savita and Mr. Keval, they have agreed, and along with Dr. Priya, she'll be the nodal person. So they have come together to work on a project where AI help will be taken to be used on a pilot scale in the OPD, where patients who are speaking in Bhojpuri, that will be automatically be translated into English, so that they can very nicely understand that what the patient is saying. And this AI will also give the probable diagnosis based on what they are saying, and also what are the alternative treatments and what should be the line of treatment, and that they can translate into Bhojpuri with the help of AI. So this will help us in connecting and bridging the barrier of the language, which will be done. And with any of the students who would be interested, I said that what you can do is they will not be making any presentation. I said whenever in the evening they can have a round table with the students who are interested in AI, discuss how it can be done with Dr. Priya being over there. And you feel free, those of you who are interested, you can work with them. And I told them to adopt one or two students and work on this project, not over here, but through and through. Because they, once you interact with them, you will see that they have already got a lot of database with regard to Samhita also. So whatever diagnosis you make, that gets validated by our Indian traditional knowledge also. So that I will not get into details. You talk to them. So I told them to adopt two students out of all of you, depending upon your skill and acumen. And those two students, they can take them through and through, and also see that some of these they are able to make it to US also and go and demonstrate their skills and knowledge in that country also. So with these words, I once again invite all the students, those of you who are interested, please feel free to talk to them on the sidelines of this conference, because already a program is set. So they will not be disturbing the program. The program will continue, but you feel free to get in touch with Dr. Savita and Mr. Keval over here, Mr. Kamal Arora ji over here, and you can discuss with them how it can be used. They demonstrated to me in my office also that how it can be done, and maybe once the conference concludes, we can work out the project for them. Because what I said was that from this conference, it should not be only lectures, and talks. There should be one take-home message from this workshop and a success story which you can present in the next workshop. And it actually is a stepping stone. Then all the time which you are spending from morning till evening over here, then this is worth it. So that's the message which we want to give from this workshop. And I wish you all the best. And I also was telling them, there is no dearth of talent in our institution. There are enough talent, and you would have already seen in the morning that our faculty and our students, they got this spark, five of them, which is the largest in the country. So that means there are very talented students sitting in this hall. So make best of the opportunity and let us see some success story. coming from our Ayurvedic college next year in October, and we'll meet again. Thank you. Thank you very much. So feel free, maybe madam, you can say one word, then I'll take.
Good evening, everybody. I'm not going to take much time. We are Vedita AI. We have integrated Ayurveda into artificial intelligence, wherein we really wanted to empower the students to really practice like the renowned Vaidyas who see 100 patients every day. So, if that one expert Vaidya can do it, then all our young kids can also do it. What is the one thing they need is a expert assistance, not that like this is a guru shishya parampara wherein we learn from our gurus, go to their places, stay there, try to understand, but this is so vast, it takes many years to do it. So that particular process we try to simplify and put all those cases there, and when a young practitioner is in their consultation, so you have a AI expert consultation software wherein any language the patient is speaking to you, so that will convert the language you want to understand, so that you are connecting well with the patient. So that is one project. Already the foundation is laid by Kamal Arora sir. He's an AI scientist. The full AI brain is already made, wherein all our Lagutri, Brahatri, Samhitas with the Tikas is already integrated there for the source of truth. So whatever we are saying, speaking, for example, patient comes with abdominal pain, vomiting kind of symptoms, that takes to past history, ask these many things, family history, and investigations. What are the investigations required? On examination, everything is supported, and then it takes to the prescription ready. So when it is suggesting Chandraprabhavati, Gokshuru Gugulu or Arogya Vardhinivati, why it is saying this particular medicine, so that takes back to the Samhita. Whatever is there in the world, it is there in our Samhitas. So that is a source of truth we connect. So it is multilingual, very well all those regional patients will get benefited to really connect with the doctor, and doctor will be effectively able to help the patient. So that problem we try to solve. We really need two very interested students to join hands in this project to make it a big success. Our students are very potential. Especially, I saw 5 students being recognized. So we really pitched this thing to our sir. So he was really interested. No, we have to report this success in our next conference. So not only in India, in global level. So by these 2 words, I would request Kavalji to show the AI brain and the patient consultation software a little bit. Thank you, thank you, everyone.
Right, I won't take too much time. Hello, everybody. So what I'm about to show you, so you see the yellow dots, the red dots, and the green and the blues, right? So this is what we are calling it an Ayurveda brain. So what's the source of knowledge in Ayurveda? It's your Samhitas. That's where we start. But in each and every shlok, there is an ocean of information. See, Sanskrit shloka was like an amazing technology, I'll call it technology back then, because the problem was to transmit the information in shortest amount of time and shortest amount of length. And shlok were those medium of transmission of that knowledge. Now we can take this knowledge and expand it and connect it through AI so we can interact with it. So that's our kind of the basis that we formed. And on top of that, we have AI diagnosis as Madam and Sir has suggested, and would love to collaborate and bring this forward. Our intention is to make AI solutions actually practical, solving instead of just saying in conferences, writing papers and things like that, but we want to land this on the ground and help people on the ground. And helping people, poor people who can speak their language, connecting them to the doctors who can speak another language would be a very noble cause in my opinion. So thank you very much.
So thank you, Mr. Kavalji and also Dr. Savita, and I must thank Dr. Maheshwari, because Dr. Maheshwari ji was instrumental in inviting both of them over here. And now you see Dr. Maheshwari taking an initiative and inviting these two very eminent scientists and experts over here. So we got a project in hand, two students we have to shortlist, and if funding is required, we'll give it from our university and we'll do a hand holding for you. And let's catch up next conference, what the result is, our outcome. Thank you. Thank you very much.
Thank you so much, sir. Through Arogya Sangam. This session focuses on integrative oncology and medicine holistic and spiritual wellness, highlighting the importance of treating whole person, body, mind and spirit in the journey towards health and healing. To formally begin, I invite our esteemed chairperson, Dr. Anurag Srivastava sir, to kindly introduce us with the topic.
तीन ही शेयर है, आप इधर बैठ जाइए। Thank you. Namaskar, good afternoon. I pay tribute to my first guru in Ayurveda, who initiated me in the learning from the ancient wisdom of sages at Maharshi Ayurveda Institute. Padma Vibhushan Vaidyaraj Brihaspati Sri Tirgunaji Maharaj, who established the All India Institute of Ayurveda, where I now serve as a consultant breast surgeon. Cancer is aptly termed the emperor of maladies, and it is rapidly increasing throughout the world. This slide from IR from WHO depicts the annual incidence of cancer in males in different parts of the globe. The Brazil tops the list with 700, nearly 631 new cancer cases per 100,000 population, and then various parts of US and India is lower down. In females also, Brazil is topping the list with 474 cases per 1,000 population, per 100,000 population per year. So what is cancer? It is unregulated cell division, a failed state of apoptosis or programmed cell death that leads to uninhibited progressive proliferation of cells, which forms the tumor. In Ayurveda, Vaidyaraj Trigunaji told me that we consider it as a state of smriti bhransh. Cells have forgotten to stop dividing. जो apoptosis कहते हैं प्रोग्राम सेल डेथ, तो उन्होंने कहा स्मृति भ्रंश, सेल भूल गए हैं कि उन्हें रुकना भी है, वो सतत प्रवाह की तरह चलते जाते हैं, डिवाइड होते जाते हैं, वही ट्यूमर का मास ले लेता है. So that is a state of smriti bhransh defined in Ayurveda. So just to keep the presentation very short, the cancer management in the allopathy, in the modern medicine, is usually a combination of surgery, chemotherapy, radiotherapy, targeted therapy, immunotherapy in various combinations. And each of them have their own problems. Taking chemotherapy, it often leads to nausea, vomiting, diarrhea, stomatitis, hair loss, and of course bone marrow suppression, leading to poor state of quality of life and poor oral health. Taking radiotherapy, it leads to depression of the mitosis, the area irradiated, and leads to side effects involving vital organs, brain, heart, lungs, liver, even the spinal cord, heart. And of course, bone marrow suppression if major part of bone is irradiated. Surgery has its own problem. If you perform major surgery, especially after chemotherapy or radiotherapy, there is a state of poor healing. It needs reconstruction of the part that is removed. It may lead to surgical site infections, deep vein thrombosis, and loss of body organs leading to mental trauma, a state of mutilation. And Dr. Yash Gupta, a renowned plastic surgeon from All India Institute of Medical Sciences, is going to speak how the ancient wisdom from Shushruta times can help in reconstruction and healing that mental trauma. So where we can integrate? We can integrate in improving the therapy of cancer, in prevention of cancer, and in palliation of cancer. So these are the three areas we can incorporate with the ancient wisdom of Ayurveda. The objective for in cancer therapy integration should be to improve overall quality of life, reducing side effects, improving immunity, improving tolerance to therapy, and overall response to therapy if possible. Ayurvedic modalities that can be used for this could be herbal medicine, rasayanas, dietary recommendations, yoga, pranayam, panchkarma, transcendental meditation, and spirituality. Rasayanas, they help in homeostasis. They produce balance in the physiology and produce bliss at all levels, from cellular level to the whole body, and strengthen the immune system. So one such rasayan that Vaidraj Trigunaji has developed, which is originally from Charak Samhita, that is Brahma Rasayan, and he developed it in the form of Maharshi Ayurveda Corporation as Amrit Kalash. So we did a randomized trial on this for last 15 years in All India Institute of Medical Sciences. So the paste of Amrit Kalash has the following herbs, and the tablet has the following herbs shown here. And so in all, about 50 herbs multiple combination, that is the sign of Amrit Kalash. So we did a randomized trial. Women who were given chemotherapy for breast cancer, half of them were given only chemotherapy, and other half were given chemotherapy along with Amrit Kalash, Maharshi Amrit Kalash. So that's a randomized trial published in 2008. And the cumulative incidence of anorexia, loss of appetite, was significantly reduced. If you see the green bar, this bar diagram shows the green bar depicts the incidence of anorexia in women who were given Amrit Kalash, MAK, compared to that of yellow bar, which is the anorexia in the control arm. You can see from first cycle down to the sixth cycle, in all the cycles, there was significant reduction or abrogation of anorexia in women with Amrit Kalash. Same happened with vomiting. Most antimitotic drugs cause distressing nausea and vomiting. So vomiting was again controlled significantly. You can see that the green bar is significantly lower than the control yellow bar in all the cycles. What happened in overall body health, general performance status, and oncologists measure general health in the form of either ECOG scale or Karnofsky Performance Status Scale, or KPS in the form of. So we measured that how much reduction in KPS occurred in women who were given Amrit Kalash compared to that of the control arm. Again, you can see significant reduction in poor state of health. Stomatitis does not differ significantly, and so did diarrhea. There was a fear in our mind that Amrit Rasayan containing high amount of sugar will cause diarrhea, osmotic diarrhea, but this did not happen. So in short, the results demonstrated that significant reduction in anorexia, vomiting, nausea, vomiting, and improvement in general performance status. Then we embarked upon measuring the tumor regression, because the original animal work had shown that about 6 cancers are prevented by Amrit Kalash in animal models. So we just wondered whether if we give chemotherapy prior to surgery in the neoadjuvant setup, where tumor is in situ, and we are giving chemotherapy and measuring the regression with each cycle, initially by clinical measurement with vernier caliper and later on by histology, is there possibility of achieving greater pathological complete remission? Because the studies have shown that if you have significant pathological remission, that is complete disappearance of the cancer in tumor, in breast cancer at least, then these ladies enjoy greater disease-free survival for longer time. So we assessed that, and our data was recently presented in ESMO, European Society of Mastology, Breast Cancer Congress, recently held in Munich in Germany in May 25. And it showed 7% greater tumor disappearance, greater reduction in women who were given Amrit Kalash compared to those in the control arm. So 7% greater pathological remission. So we can also integrate in prevention. Ayurveda can help in tobacco cessation, alcohol cessation, drug de-addiction, yoga and pranayam, and sattvic nutrition and spirituality. Now we come to the state of health. Normally health को कहते हैं हम लोग स्वस्थ रहेंगे, स्वस्थ. So deeper meaning of आध्यात्मिक meaning of स्वस्थ is this. My Param Puj Guruji, Swami Geetanand Ji used to say when we used to go there, he said, स्वस्थ रहो, स्वरूपा रूढ़ रहो. Swarupa rule means Atma Bhava mein sthit. Adi Shankaracharya has defined Swasth as Sway Atmani Sthitah, means apne mein sthit rahen. That is the real meaning of Swasth. If you stay in that state of health, Swasth, then you will be free from all physical, mental ailments and diseases. So that is the real meaning of Swasth. And how to become Swasth? By becoming Gunatit. So this is again quoting from Bhagavad Gita, Prakasham cha pravritim cha mohameo cha pandav na dveshti sampravartani na nivritani kanchati udasin vadasino gudario na vichalate gunavartant iteva yotishtati dengate sam dukha sukha swasth. See the swasth. Sam dukha swasth, sam loshta, sam kanchana, tul priya priyo dhilas, tulinda atma sasti, mana apmanyo stulyas, tulyo mitrari paksho, sarvaram paritagi gunatita sochate. If you become gunatit, then you will attain the state of perfect health or swasth. So we should all aim at this state of health, not what WHO has defined. So how can you be that? Use green leafy vegetables. There's a lot of research on broccoli. It contains high amount of sulforaphan and prevents cancer deaths. Prevent obesity, because obesity is related to 13 different types of cancers in the body. Eat healthy diet. In Hindi, they say, "Jaisa khai ann, vaisa rahe man." What one eateth, so he becometh, is the old English proverb. And a lot of research has gone into this. There are two types of diets. One is pro-inflammatory diet. Red meat, processed meat, sugarated drinks like Coke, Pepsi, and such refined carbohydrates, maida, white chawal, white rice. These are pro-inflammatory diets, and when you eat them, they cause release of profuse amount of cytokines, similar to what you had cytokine response during corona. So same kind of cytokine response occurs each time you eat these foods. And if you continue to eat these foods for a long time, American Heart Association has revealed that they will increase the risk of cardiac disease and also cancer. So avoid pro-inflammatory diet. Red meat as intake has associated with 4 types of cancers. Again, we take the ancient wisdom, yukta har viharasya yukta cheshtasya karmashu yukta sapna bodhasya yogo bhavati dukha. Then only we can attain perfect health. Ayu sattva balarogya sukha priti vivardhara rasna isnigdha istira hridaya ahara sattvic priya. So if you eat sattvic diet, which should contain fresh fruits and vegetables, including some snigdha. Snigdha means fat. So it is wrong to say that fat-free diet should be taken, cholesterol-free diet. Cholesterol is the mool mantra, mool sroth of all the steroid hormones, estrogen, progesterone, pregnenolone, testosterone. They are all produced by cholesterol. So we must eat some amount of fat. Katu amla lamad ati ushna tikshna ruksh vidahina ahara rajas shrestha dukha shoka may prada. Lord has taught us 5,000 years ago that if you eat these kadve, khatte, namkeen, ati garam, then you will get pain, grief and diseases. But we forgot that knowledge. Uchchishtam abhi chamedhyam bhojanam tamsa priyam. यम कहते हैं एक पहर को, तो दूसरे पहर में अगर खाना बनाए तो इस डेफिनेशन से वो बासी हो जाता है. सो डबल रोटी जो आप खाते हैं, ब्रेड आज बेकरी में बनी, कल शॉप में आई, परसों आपने खाई, उसकी सैंडविच बनाई. So I learned this joke about 20 years ago, and then I have stopped eating double roti and bread. It is tamsi. Stress is the leading cause of cancer, and the research shows that it damages the DNA repair mechanism in our body. Therefore, we should plant anti-cancer herbs. There are some of these: tulsi, kalonji, haldi, lemongrass, adrak, garlic, broccoli, sadabahar, and so many of them. Dr. Srivastava from Lucknow has enumerated a lot of these herbs. So Ayurveda can help in cancer prevention by promoting healthy lifestyle, sattvic, healthy life eating, dietary advice, relief from stress by meditation, pranayam, panchkarma, tobacco, alcohol quitting, and it can overall improve quality of life, especially cannabis indica. There's a lot of research. There's an institute, Marijuana Institute in Mississippi, whole institute dedicated to just research on marijuana, cannabis, which can improve appetite, control nausea, vomiting, sense of well-being, and prevent some cancers. So I conclude here, ladies and gentlemen, by saying that Ayurveda can help in cancer prevention, it can help in improvement of cancer regression, reduce certainly the side effects of cancer therapy, improve immunity, and therefore improve overall quality of life. Now, I invite my very esteemed, learned experts, Dr. Divakar Shukla. Dr. Divakar Shukla. Sir, you have your presentation. Please, please. Thank you. Please.
Oh, right. Okay.
I invite our esteemed resource persons, Dr. Divakar Sukul Sir, PhD, AFDPS, CP Psychol, HCPC, Chartered Clinical Physiologist, Hypnotherapist. Now I kindly request Dr. Sandhya Pathak Ma'am, our co-chairperson for this session, to kindly introduce the esteemed resource person.
Sir, Dr. Divakar Shukul sir is clinical psychologist and pioneer of multidimensional healthcare, founder of Cosmos Clinic in Harley Street, London. He developed innovative therapies including body-mind energy assessment and mind-body connective therapy. Sir is internationally recognized by blending Eastern and Western approaches. He is the chairman of International Book of Honor, England, and founder of the Vedic Research Center, Cosmos Indo-UK Leadership Summit. His work has been featured on BBC TV and major UK media outlet. I welcome you, sir, to enlighten your knowledge to us.
Thank you. Thank you for inviting me, Dr. Maheshwari. Thanks a lot. And let me tell you something. I mean, you were just talking about Dr. Brihaspati Trayaguna. Have you heard his name at all? Dr. Traygunaji. Vedraj Traygunaji. Yeah, Vedraj Brihaspati Trayaguna. You know what he has contributed to Ayurveda? Have you ever contemplated on that? He's the one who trained Mahesh Yogi. Mahesh Yogi and Brihaspati Traygunaji, they started the Mahesh Yogi, you know, in Holland, and Dr. Deepak Chopra. He's the one who was a cardiologist in Delhi, and then he started practicing in America. He's one of the most renowned person in the field of not only on Ayurveda but self-improvement. So I think Ayurveda, when you're talking about Ayurveda, how it can really help us. We just a couple of years ago, we started British Ayurvedic Medical Council after 20 years of a struggle. But I introduced this Ayurveda for the treatment of addiction back in 1992 and 91, 92. And let me share this journey with you. The journey of integrated, like this morning we have been discussing about what is integrated medicine. That we also talked about that if someone who is trained in allopathic medicine or Ayurvedic medicine or whatever therapies you say, then how we can bring these things together. I think that was one of the challenge. We noticed when I started working for Turning Point, it was our patron was Princess Diana, and also I started working for Health Clinic. Our patron was at that time he was Prince Charles. Now he's a King Charles. Very much interested in integrated medicine. He started working in the field of integrated medicine a long time ago because he wanted to promote overall well-being. Let's talk about cancer. When we talk about cancer, what it is, we talk about cancer just only a physical disease, but it is also affecting our body, mind, family, and also all the spiritual dimensions. So this is what we call, it's a multidimensional disease. And I will talk to you about how this multidimensional approach can be used to bring different kind of therapies together. So modern oncology is effective in tumor control, but healing requires integration of complementary or alternative therapies. So all of you might be aware what is complementary or alternative. For example, in West,
Modern medicine is a medicine, and Ayurveda is, or homeopathy is considered as alternative medicine, whereas Reiki healing or any other therapies, they can be considered as complementary therapies. We understand about the burden and limitations of what we are experiencing in the field of cancer. Like 1 in 2 individuals face cancer in their lifetime in UK. And we understand that, if you have longer lifespan, there may be a better, or there may be a higher chances for you to experience cancer. I don't know. I mean, you just shared about some of the challenges what we are facing in India. But conventional treatments like chemotherapy, radiotherapy, surgery, they are effective, but they also cause a lot of side effects. And where I think all of you, when you're getting trained in Ayurveda, just keep your mind open that how it can be, how you can support the patient, not only as an alternative therapy practitioner, but also as a complementary therapy practitioner. So we need to address the person behind the tumor. What does it really mean? That whenever there is a tumor, like Sir just mentioned about the stress, we understand about the stress. Whenever there is a stress, there is a high level of cortisol that affects our immune system. When your immune system is compromised, it affects, your immunity is less, you can get cancer, for example, but we don't have much studies on that so far. So we do require a lot of studies on this. When we talk about integrative oncology, because we have a great oncologist here, so I will be not talking too much about oncology, but it should be patient-centered, evidence-informed approach, and it should combine your mind, body, soul practices, natural products, and lifestyle interventions alongside conventional treatments. The goal should be improve the quality of life, reduce side effects, what we have been discussing this morning, support immunity, empower healing, prevent relapses, and increase longevity. So let me share this journey with you. My journey. It started in 1991. Addiction or de-addiction has been my specialist field. I started my work in India. You might have heard the name of Kiran Bediji. Have you heard? She was the one who introduced the concept of MGUG clinic in Delhi. At that time, we had a major problem of a smack addiction. I was studying there, and in my opinion, she was my first mentor because she is the one who brings the concept of vipassana, meditation, Ayurveda, not Ayurveda, homeopathy, and yoga therapy, etc. I introduced group psychotherapy and hypnotherapy for the treatment of addiction there. But when I moved to UK back in 1990, I noticed I worked for one of the biggest psychiatric and psychogeriatric hospitals. Then I got a job to run one of the Princess Diana's projects called Turning Point. And it was an interesting journey for me. Why? Because what we have noticed that you treat patients today. After a couple of months, they are back to your clinic. There were high rates of lapses and relapses because whatever we have been doing with the conventional or modern medicine, with the psychotherapy, it wasn't really clearly working. So I got an opportunity and I got a funding to introduce a lot of alternative and complementary therapies for the treatment of addiction. And what we did, we introduced Ayurveda, we introduced acupuncture, we introduced music and mantra therapy because this morning somebody was talking about Om. What is Om? You know that language creates vibration. Any sort of mental health problems, what you experience in your life, it starts because if you read Patanjali, you will say that mind, he talked about mind in 3 functions of mind. One is recording. How do we record? Through our 5 senses. That's why when you had any argument with somebody, it stays in your mind. Second part of that is the power of discrimination. What we are talking about cognitive behavioral therapy these days, it is all about really understanding whether it is a problem or not problem, how big the problem is. But the third problem, or third function of the mind, what we talk about is ego. Ego means identification. आज आपको किसी ने कुछ कह दिया, आप उसके बारे में सोचते रहते हैं क्योंकि आप उससे identify करने लगते हैं. So if you just think about all these kind of resources that you have in Ayurveda, in Patanjali, in yoga, how it can be introduced in the field of mental health, or any sort of integrated psychotherapy or integrated therapy. So what we did, we introduced this music and mantra therapy, color therapy, reflexology, acupuncture, shiatsu, etc. And we started noticing that the patients were staying with us for a longer period of time. And the quality of life was improved, and there were less lapses and relapses. It was also, there was evidences that were created, and alcohol concern as a being independent body, what they said that these kind of models can work. So this was the first approach of integration of a lot of different therapies. But something was still missing. What was missing? That what we noticed that, let me introduce this. This is the multidimensional model of healthcare. When you talk about human, this is a human. Then we talk about body, we talk about their mind, energy, and environment, for example. We have somebody talking about Vastu and energy, etc. today, right? So whenever there's an imbalance on one dimension of your life, for example, like Dr. You were saying about 90% of problems are psychosomatic. It will start with mind and then it affects your body, So if it's anything that starts from body, it can affect your mind, it can affect the flow of your energy, and also it will affect the way you interact in this world. So this concept, what we talk about integration. We talked about integration in terms of, sorry, can we go back? Yeah. So it is based on multidimensional assessment. So what we did, that when I stopped working for Turning Point, I introduced this concept of multidimensional healthcare in the UK. And that was the first multidimensional healthcare clinic in the world, which was based on assessing the person in totality. What we talked about 4 dimensions, we created like 3 assessments for them. One assessment was carried out by a medical doctor, another assessment was carried out by a psychologist, and third by the alternative of complementary medicine practitioner, for example, acupuncturists, because they understand about the flow of chakras or energy, or Reiki healers or so on. And these 3 people, they used to sit together, like what you were talking about, or one of the doctors, he was talking about just, name hand. We used to sit together, and before introducing this concept, what we did, that we created a team. So team of anybody who's working with the body, people, those who are working in the field of mind, people, those who are working in the field of, energy and environment, etc. There were 3 teams we created, and what we did, we encouraged people to understand each other. For example, if you are an allopathic doctor, you should really understand about Ayurveda, get Ayurvedic consultation done, and also have some treatment done by the Ayurvedic physician or acupuncturist. So all of them, they used to work together. It took almost 6 months for us to create that kind of teamwork, because everybody feels that I'm superior. For example, a lot of alternative medicine practitioners, they think that we are the best. Or sometimes in allopathy, they think all these things have a placebo effect. But if you just look at that, everything got its own space or own place. So what we have to do is to really look at where the problem started, what we discussed about the multidimensional model, mind, body, energy. These 3 assessments we used to carry out by the expert, those who were fully familiar with the concept of what is good in their field, and it was based on patient-centric, but based on after the assessment, they used to make the recommendation what could be the most suitable way of treating the patient. So it was a combination. So it was a true integration, which was also reviewed on a regular basis, like after 3 months or 6 months, this is what we used to do. So this is the approach which we can really look at. I know that I have a limited time, and there are a lot of great people. You will be hearing Dr. Yash Gupta and Dr. Maheshwari and Dr. Neeraj as well. So I will be not taking too much of your time, but this is a multidimensional model which is based on integrated medicine or holistic medicine, which we introduced in 1998. If there is anything we can do, we can talk about it. I'm very happy to be part of that. There is a body, mind, energy assessment. I can share the BME assessment with anybody who is interested in learning more about it. This is the approach, and this is the physical well-being, mental well-being, energetic well-being. These are the three dimensions which we offer when we are talking about integrative approach. These are the kind of therapies. If you go to our clinic, campus clinic, you'll find that we have this number of different kind of therapies, different consultants, but they all work together. The concept is your patient is the most important one, and just assess them correctly, offer them treatment, and then review it on a regular basis and make sure that you readjust the treatment. This is your model, mind, body, soul connectivity. Remember that everything starts with the Anamaya. So your 5 elements. Anomaya kosha, Pranamaya kosha got a impact on your Manomaya kosha. So your vital forces, your mind is connected through your breath. So your mind is also a bridge between your body and soul. As you might be aware, that if you take your mind inward, it gives you the solution. So what we have to do, everybody is looking for some sort of a happiness in their life, isn't it? Bliss is the ultimate goal of everyone. So how we can start? Start with your Anomaya Kosh, work with your Pranmaya Kosh, then look at how it can have an impact on your Manomaya, and then intellect. An ultimate goal is to achieve Atma Bodha. That's what we just talked about. So this is a multi-dimensional approach. What I suggest for the Ayush model, if you want to really think about, Ayush is not going to work unless we bring all this comprehensive assessment. Because at the moment, patients are choosing, let's go for yoga, let's go for Siddha, let's go for acupuncture, or whatever it is. If we can offer them the comprehensive assessment and then choose what could be the best way of treating these people. And for people like you, the students, you should really have a research and curiosity. Why and how? Why somebody is suffering? Like recently, when I was doing my autism clinic, and we know that we don't have a lot of therapeutic intervention there, but what I started noticing that there's some number like numerology, the vibration, the astrological chart. If you start doing, it was a part of your conventional treatment. Where they used to do your chart, astrological chart, before they used to prescribe you the medicine. So all these things, you should have a research and curiosity, have open communication, because majority of the patients, not only in India, but also in the UK, most of the patients, they see the complementary or alternative medicine practitioner alongside with the modern medicine if they're experiencing certain challenges, but at the same time, they never talk about it. It's the same thing here, that if somebody is coming to oncologist, they will just talk about Dr. Sahab, mujhe bacha lo, but they will never share that they are going to the spiritualist or whatever, Ayurvedic physician. So have an open communication, teamwork, and experience other therapies with an open mind, patient-centric approach. Spiritual astrology, homotherapy, there are a lot of research on homotherapy, Ayurveda. Functional medicine is a part of Ayurveda. If you connect functional medicine with Ayurveda, you will see what is the significance of rejuvenation. Because you can pick up the cellular age. When you give them the medicine, you can see whether there is an age reversal that is taking place or not. Nutritional therapy, etc. Mind-body harmonic therapy. Keep 5 kosha model in your mind. And, just my 30-second personal experience. Before I was going to the UK, my mother had, she had a kidney failure. And, I was in 2 minds. And one of the vet there, he said to me, you go to London, you go for your studies. And then there was one acupuncturist, he said, I will treat your mother. And I will give it to you when she comes back. Unfortunately, she had a multiple myeloma. And then after a year when I came, when I landed, same night, we lost her. But that has given me the confidence that, all these practices, what we have, they can really help us to achieve our goals, improve the quality of life, and maybe we can improve the longevity. Thanks a lot for your time.
Thank you, sir, for your valuable presence and thoughtful reflections. Next up, we have Dr. Yash Gupta, sir, Resource Person, MS, FRCS, London. I now request Co-Chairperson Dr. Sandhya Pathak ma'am to kindly introduce our second resource person, Dr. Yash Gupta, sir.
Sir is a renowned London-based surgeon and AIMS alumnus, known for his expertise in plastic, cancer and trauma surgery. One of the youngest to earn the fellowship of the Royal College of Surgeons UK. He trained in Oxford and London with additional specialization in emergency and trauma care. A Harvard Leadership Program alumnus, he has served as visiting faculty worldwide and is recognized for his contribution to both medicine and integral Indian heritage. His recent book, Science and Sanskrit Sculpture, launched at the Indian International Center, received appreciation from leaders including Dr. Jay Shankar and Meenakshi Lekhi. His name is inscribed on the Wall of Honor at the Royal Society of Medicine, London. I welcome you, sir, to enlighten and share your knowledge with us.
Hello, can you hear me? Okay, how do I start this? Yeah, pressing this. स्टार्ट कर दीजिए इसको. हाँ, अच्छा, थोड़ा पीछे जाइए. Okay, I got it. Thank you. Pretty late in the evening, so I hope everybody is still awake. But what I'm going to show you now will certainly wake you up, okay? That much is guaranteed, right? So I'm a graduate of All India Institute of Medical Sciences, and after doing some house and SHO jobs, I went to England and became a fellow of Royal College of Surgeons, and also I trained in plastic surgery in Oxford. Now, this talk is in two parts. The first part is about the ancient surgery, and I'm going to talk about Sushrut Samhita here. And I'm going to show you some slides, you'll be impressed to see that. So let's start with that. So, Department of Plastic Surgery in Oxford. So this is the Radcliffe Infirmary, very famous plastic surgery center. And this was our team, and then you can recognize me up there on the one with the biggest smile, I think it's me. And so what happened there, I did some work on advanced breast cancer treatment. So I did a series of about 30 cases of very highly advanced breast cancers, and nobody would touch them, because if you create a big hole, how do you cover it? So that's the big question, and that's what plastic surgery is all about. Most of it is about covering big holes after cancer surgery with some flap. So I published a paper, and I was invited to New Delhi in 1987, and I presented this paper at the International Conference of Plastic Surgery. And this was very well received, and I was invited by the then President Zail Singh to the presidential palace, for a dinner. And there I met across some big dignitaries who said that, why don't you come and do some pioneering reconstructive surgery work in India? So I came and spent a couple of years there as well. And I was leading a plastic surgery unit then. So now, this is the interesting bit. How many of you have seen this slide? Raise a hand. You are working in Ayurvedic system. This is the Bible of Ayurveda. This is the Bible of Ayurveda. This is how Sushrut wrote a Samhita, Sutrasthan, Prathamodhyaya, chapter 1, Origin of Ayurveda. Athoatpatti Vedatpatidhyam Vyakhyanam. 500 BC. That is the estimated. Nobody exactly knows when Sushruta worked. We know that he worked in Kashi, in Banaras, but nobody knows. And he writes his Samhita saying, Yatho Vach Bhagwan Dhanvantri. So we don't know whether this is the original Dhanvantri who got the Kalash from the Amrit Manthan, or there was another Dhanvantri who actually taught him all the surgery. So a little bit work needs to be done on that front. Now this is a conceptual drawing of Sushruta doing his surgery. You can see that's very brightly lit, and he describes it. It should be clean, fumigated, everybody should have a bath, and it should be done in sunlight. So this is very important. He's already describing the principles of surgery here. And what is Ayurveda? Ayurveda is life, and Veda is science, and Ayurveda is science of life. To cure those who are afflicted with disease, and also to maintain the health of healthy. So this is holistic medicine for you. This is already integrated into Ayurveda. And Sushruta Samhita, he describes 8 subdivisions: surgery, medicine, ENT, psychiatry, obstetrics. This is the curriculum of modern medical schools. This is what we teach all over the world. These are the main 8 branches that all medical students all over the world are taught. And this coming from Sushruta Samhita, written at least 2,500 years ago. I'll show you some of his work. Chapter 16 of Sutrasthana specifically describes reconstruction of a lost ear lobule using a piece of skin which is attached to the cheek, which is alive by its continuation. Sanu bandhena jivita. This is the first ever description of a flap anywhere in the world. And I presented this paper at the Royal College of Surgeons and got a standing ovation for bringing out these facts. So now look at this. These all shlokas are taken from his Sushruta Samhita. In the absence of ear lobule, the expert plastic surgeon would elevate a living flap from the cheek, connect it at its base, and he should rotate it to reconstruct the ear lobule after scraping. So this is my interpretive drawing here. This has been raised from this nasolabial flap from the cheek like this, and has been rotated to reconstruct the ear lobule. Then he described the rhinoplasty. Rhinoplasty is reconstruction of the nose. So now he says, now I would describe the proper method of rhinoplasty when nose has been cut off. And so he describes the tree leaf, like a template, and then he describes the flap to be rotated, and then post-operative care. And look at this. He was so methodical, so exhaustive. Having examined the nose, which has been properly sutured and correctly shaped, the same should be fixed with 2 tubes. Then powder of red sandalwood, Madhulika Rasayana should be sprinkled on the nose. I mean, this is a magical powder for us. I think somebody should do some research work on how good this concoction is. And then the final appearance. So look at the details in which he goes. So this is my interpretation of, these are my drawings. So this shaded thing is the tip of the nose has been cut off like Shurpnaka. The Lakshman cut off the nose of Shurpnaka. So it was considered a punishment. Okay. So there was a big punishment those days, and there was a big market for Sushruta to do the rhinoplasties. So he raised the nasolabial flap, which I've shown on the side, and then he puts that flap on the nose after cleaning it, and then puts the 2 tubes which he talks about for the breathing, and then and then he returns it, and then the rest of the flap stays because it has picked up vascularity from the nose. And so it's interesting that he actually filled the gap of cleft lips also using this flap technique. So like this. So he will raise the flap and then look at this. So this is one of my patients, and this is exactly what he did. Raised it from the nasolabial area and filled it up. But now we do it slightly differently. We actually join the muscle, not just fill the gap, because that's very important for functional. So we get, this is one of the post-op results of my case. So this is the kind of results we're talking about. So it's functional and aesthetic both. So people think plastic surgery is cosmetic surgery. I think cosmetic surgery like breast augmentation, nasal reshaping, these are just like less than 5% of plastic surgery work. Main work is trauma. And I'll show you some other slides here. So these are some of the instruments which Sushruta described. He described hundreds of instruments, blunt and sharp. And look at these, some of these things, they look like, the needles and everything, they look like modern plastic surgery, modern surgical instruments. So I carried out extensive work because there was an article in BMJ. Now we talked a lot about research here. So I read an article in BMJ saying that somebody had done a forehead rhinoplasty. So you take a piece of forehead and put it on the nose. That came to be known as Indian forehead rhinoplasty. And somebody said it's Sushruta's rhinoplasty. So I said, I've read Sushruta. I did not come across a forehead reconstruction. He was a cheek reconstruction. So then I traced the origin from Sushruta, how it was propagated to Europe and to Arab and to Europe. And this is where the Kashi, you can see, this is a map of India, 600 BC. So Kashi, and then this is the road which I traced. So it first went to Arabia, where it was known as Kitab-e-Sushrut. It was known as Kitab-e-Sushrut. That was a standard textbook of medicine and surgery for 2,000 years. 2,000 years. And this is where I presented at the Royal College of Surgeons. And this is Professor Antia. He was a famous plastic surgeon in India and personally came and congratulated me for this presentation. Now I'll show you some of and this is what we're talking about, a flap. So from the side of the nose, a cancer has been resected, basal cell carcinoma, and then a flap is raised, and you can see on the left how we drop the flap and this leaves no scar. So a gap has been filled without leaving a scar. But what I call it a reconstructive ladder. I figured this concept that more complex the defect, more complex techniques you will need. So, for example, this is a foot avulsion in an accident, and all the tendons and bones were exposed. So here, we can't put a skin graft because that's no good for covering the bones and the tendons. So this is a free flap. This is taken from the forearm. It's called radial artery forearm flap. So a big chunk of skin has been taken, just preserving the arterial and the venous supply. And then we find some vessels here and we plug that in. And this is the result we get. So this is not only matching the aesthesis, but also the function, because you can't put a bulky flap on the foot. And this is the guy who had a crushed injury, and his arm almost came off, and I reconstructed it, and it took me about 7-8 hours to reconstruct this. And now I'm showing you the functionality, how functionality is important, not just aesthetics. The bad-looking scars we can revise later, but if the nerves don't grow, the muscles don't function, it's useless. And so, in fact, this is he's driving the car. You can see a glimpse of me just there. I used to have mustache in those days. And now this is like circular saw injury. Fingers are detached, and here's the result after microsurgery. And what is this here? Anybody? What is being shown here? Speak up, you can speak up. हाथ कट गया किसी का? चारे की मशीन में कट गया हाथ? हाँ, pressure injury, very common injury. क्या करेंगे इसका? What will you do with this injury? बताइए, कुछ बोलिए. Any idea? Because thinking is common, whether it is Ayurveda or allopathy, or thinking is common. You got a problem, you identify the problem, and then you find a solution for it. Join it. Oh, very good. Okay, so we exactly did that. So how long do you think this operation would have taken? About 10 hours. About 10 hours. So we have to join artery, veins, we have to join 2 nerves, we have to join 16 tendons and all, and bones and everything. There's a big work, and after circulation has come, then we see the nerves are being regenerated. And then once the nerves are regenerated, then we know that our job is done. For example, this chap had a lip injury, he had a laceration, big, thick laceration. So what would you do with this? What kind of surgery would you do for this? Join it up, yeah? Simple as that. So what is the main function of the lip? Speaking, whistling, and other functions, which I won't list here. But you need the muscle for that. So focus here is to join the muscle first. Okay? So we join the muscle, and then we give very neat suturing, and then this is the result we should get. So this is functional and aesthetic plastic surgery. And now I'll show you a technique which I use quite a lot. I developed, and this is called tissue expansion. So this was about 14-year-old boy who lost a lot of skin after an accident on the forehead. 1/3 of his forehead was gone. So what you see on this side is a flap, a scalp flap which has been dropped to cover the bone, to preserve the bone. Now he can't live with this hairy forehead for all his life. So what do we do? Where do we get this 1/3 of the forehead from? Huh? Where? Speak up, speak up. कहाँ से लाएंगे ये forehead बाकी का? No skin matches the forehead skin. And how will you bring it? So what we did, we expanded, we put an expander like a plastic thing, which you expand over a period of 6 weeks. So this is what you get. So effectively, we have doubled the size of the skin. So when we take out the expander, we'll have excess skin left. And then we return the flap back and recreate the forehead. So these are tissue expansion techniques. Now we talk about cancer. This is what advanced breast cancer looks like, if anybody of you have seen. And a lot of cancer specialists would have seen. What do you do with this? This is the series which I published, and I did a case, 30 cases out like this. What would you do? Any ideas? Take it out. Okay, how would you, there's a big gap. Probably you'll have to take out the ribs as well. So there'll be a big hole left. How are you going to fill that up? Suture it up. Good idea. So what we did was, there's a big muscle here with skin over it. We call it as the latissimus dorsi, big flap. So latissimus dorsi, along with all the skin, is lifted and then it's transposed to cover the defect like this. Okay? So all the cancer is, now survival rate, because it can metastasize and so on and so forth, it can recur. So I looked at the longevity of these cases, and average we achieved like 3 years after surgery, which was hitherto unheard of, because with a cancer like this, with no treatment, even if you give chemotherapy, they will die within a few months. So similarly, this case, you can see, this is not just a recurrence, but can you see something in there, deep in there? What is that? That is radionecrosis. So it's been fried by radiation. So this will never heal because all the tissues have been fried. So the only way to do it is to cut it off, raise a flap, and you can identify my hands there, and then put it in there. So this is how you do the treatment of advanced cancer, and the same principle is applied for head and neck cancer as well. So once you cut half the jaw off, what you do, you have to know how to reconstruct it Okay, so that is where reconstructive, plastic and reconstructive surgery comes in. And I don't know whether this will play. No, I think these videos are not playing. These are some of the videos of the microsurgery reconstruction of a badly traumatized leg, which has been fixed with external fixators. You would have loved to see this, how we actually create the flap, free flap, and then how we plug it in. And it's nice to have recognition. And before I go, I was at Harvard in 2012, and I went on a leadership program. I was one of the only one from UK. 15 people they invited, and there I came across certain verses which changed my life, and they were from Brahm Samhita. And if you give me another hour, then I can talk about that. But I will close at that. Thank you very much.
Thank you so much, sir, for being with us and sharing your insights. Next up, we have with us Dr. Naveen Kumar Singh, sir, resource person, head and neck oncosurgeon. Let us now proceed to the introduction by our co-chairperson.
Sir is a senior head and neck oncosurgeon with over 17 years of experience. Currently serves as a regional head project business development at the International Oncology Center in Cancer Center, India. He is known for his commitment for affordable cancer care, community outreach for early detection of head and neck cancer. Dr. Sir Fellowship in Head and Neck Surgery and MBA in Healthcare Administration. He has served as the leading hospital like Fortis, Max, combining clinical expertise with the leadership in oncology project development. Sir, I welcome you.
Thank you for introduction. Good evening, everybody. So my presentation is will be one-to-one interaction because everything which I had made earlier has been discussed. So my presentation will be some like one-to-one questions with you. So first, who had made this Rangoli? This beautiful Rangoli of theme of 2025. Please raise your hands. So this is a very good interaction between tradition therapy and modern evidence-based therapy. So what will be the theme of 2026? I think sir has said what will be the theme of 2026. Yes, that will be mixed with AI. So what you will think is AI will be a complementary, or it will definitely, as sir was saying, that जो भी ओपीडी में अगर हमें हिंदी नहीं आती या ऐसे है तो क्या वो हमें कॉम्प्लीमेंट कर रहा है या फिर ऐसा है कि सब डायग्नोसिस एंड एवरीथिंग इज इन फ्रंट ऑफ यू, तो आप हमारी जरूरत क्या रह जाएगी? आप क्या सोचते हो इसके बारे में? Will it replace or it will be complementary? That is great. Next slide. So I first congratulate to you all, जो भी स्टूडेंट यहाँ पर है गुरु गोरखनाथ यूनिवर्सिटी में, because you will be this university will definitely, अगर इसका जो बेस है वो इतना स्ट्रांग है, so you will be really torch bearer in coming future. Please change the slide. So about myself, I'm MBA. I'm in legal state. I'm in legals. I'm LLB, medical legal expert, and I'm also MBA from FMS and IFT, all Pioneer Institute. So I can see आप भी ऐसे Pioneer Institute में हो, and you will be one of the brightest in coming future. So I'm starting. May all be happy. May all be free from illness. Sarva bhavantu sukhen, sarva santu nirmaya. when we begin today with this spirit, because every patient who enters through our door is not only a body with disease, but a story, a culture, a consciousness that wants to be seen. हम लोग कितना देखते हैं पेशेंट को, क्या जब भी कोई पेशेंट आता है हमारे पास ओपीडी में, हम लोग कितना देखते हैं कि हम सिर्फ उसकी डिसीज देख रहे हैं, या हम ये जानने की कोशिश करते हैं उसका कल्चर क्या है, उसकी थॉट प्रोसेस क्या है. वो हमारे पास एज ए आयुर्वेदा थेरेपी लेने आया. सो क्या हम उसको आयुर्वेदिक थेरेपी के साथ साथ प्रमोट कर रहे हैं, क्योंकि यहाँ इंटीग्रेशन की बात है. सुबह से जो बात हो रही थी वो मिक्सोथेरेपी और ये सब, अभी सर ने बताया था कि मिक्सोथेरेपी और ये सब, और कैन यू डिफरेंशिएट मिक्सोथेरेपी विद इंटीग्रेटेड अप्रोच. सो बहुत बार ऐसे पेशेंट्स होते हैं जो हमारे पास एज ए आयुर्वेदा में आते हैं और हमको लगता है कि आयुर्वेदिक नहीं, इसमें एलोपैथी ट्रीटमेंट भी चाहिए. सो क्या हमारा माइंड इतना ओपन है कि हम इसमें कोलैबोरेट कर सकते हैं? क्या हम अपने कलीग्स को भेज सकते हैं कि बॉस मैंने इतना ट्राई किया है, क्या आप इसके बाद की थेरेपी दे सकते हैं या कन्विंस कर सकते हैं? दिस इज द मेन थीम ऑफ दिस slide. So healing beyond the tumor, a proposal for culturally integrated head and neck oncology. So milestone in medicine in Bharat. In ancient India, we were practicing as a charak, sushruta and culture-based scientific medicine. But over centuries after Mughal invasion, British Raj, this ancient medical wisdom decreases and was sadly replaced. Now it is a perfect time where we can integrate the past and future. So now it is a time that we are working as in robotic treatment. We are giving robotic treatment. These are the slides which I am practicing in Fortis. Back कैसे रहेगा? So now it is AI and big data is empowering us. Along with that, if we add culture here also, it will be the best scenario. So AI and big data. So next year theme is also we are introducing AI and all. So AI with big data, medicine with Ayush should also be complementary to each other. We should be all welcoming, and we should welcome each other therapy with open arm. So these are some examples I am just adding. What these are the because I had changed my slide. So these are the surgeries which I had done in just last 15 days. So what is right now we are doing is, this is like we are using latest technique. This is like first of all I want to say that what I am right now trying, that I am incorporating ENT, head and neck, dentistry, and plastic surgery, and which is definitely is here in Shalyakya Tantra. You are practicing dentistry, and this is the yes. So what is latest we are doing is we are making 3D this processes. We are incorporating it, and this is a defect which is covered with this 3D printing. So it is on our mission to provide the best comprehensive, collaborative and affordable head and neck care in NCR region. Our recent case, this was our recent case with 3D printing jaw, and we had incorporated. Now this is again I would ask some questions. So this was a case which was having a CM axilla. We had operated earlier. It was operated. It was reoccurrence. It was reoccurrence. It was radiated. It was chemotherapy was given. So we had done again a surgery, that is plastic surgery with forehead flap and temporalis flap. So what we can do the next is like Ayurvedic diet. We can prescribe dental prosthesis, medical astrology. Again, the very important thing. We should incorporate this. Massage for lymphedema. which we after surgery it is getting beyond below the eye. Now, next is this case. What Ayurveda and this can be added in this case will be gel neti, dental prosthesis, facial massage, Ayurvedic diet. So I think we can collaborate each other and we can help. So this will definitely give the good results. So I want to add that we should complement each other. We should add. We should know what are our limitation and what could be done. That will definitely help a good outcome, and the patient will be much better and will be good. So I'm concluding. The body indeed is a primary instrument of dharma. Our duty is to preserve that instrument not only by curing the cancer, by honoring the culture that gives its meaning. Thank you.
Thank you very much, sir, for contributing your expertise to this seminar. And now, I once again request our co-chairperson, Dr. Sandhya Pathak ma'am, to introduce our next distinguished speaker, Dr. Sanjay Maheshwari sir, Medical Director, MP Birla Group of Hospitals.
सर का परिचय देना मतलब सूरज को दिया दिखाने बराबर है. सर मेडिकल डायरेक्टर एमपी बिरला ग्रुप ऑफ हॉस्पिटल और सीईओ इनोवेशन रिसर्च इंटरनेशनल रिलेशनशिप महायोगी गोरखनाथ मेडिकल कॉलेज गोरखपुर के ट्रेन सर ने कैंसर यूरोलॉजिस्ट एडवांस लैप्रोस्कोपिक सर्जरी में महारत हासिल की है. सर ने 40 साल में 4 लाख से भी ज्यादा छोटे से बड़े मेजर सर्जरी किए हैं. सर ने बहुत ही प्रतिष्ठित कस्तूरबा मेडिकल कॉलेज मणिपाल मैंगलोर से अपनी पढ़ाई शुरू की और उसके बाद टाटा मेमोरियल मुंबई, केईएम मुंबई, यूके और इत्यादि से अपने ज्ञान के पथ पर चलते रहे. सर ने एक रिकॉर्ड बनाया है जिसमें 66 केजी ओवेरियन ट्यूमर का निर्हरण किया है. सर मैं चाहती आपसे अनुरोध करती हूँ कि आप ज्ञान रूपी गंगा को हमारे पर भी पहुंचाएं.
Good evening, friends. Respected chairperson, my teacher, Dr. Anurag Srivastava. On the other side, our senior teacher, Dr. Yash Gupta from UK, Mr. Yash Gupta. He is an FRCS, so they become Mr. Barbarian. From barber, they become gentleman. That's what is said, right? And Dr. Divakar and my co-partner on to oncosurgeries, which he has shown, Dr. Naveen. I first of all, ऐसा है कि मैं महायोगी गोरखनाथ यूनिवर्सिटी के इस प्रांगण में आप सभी लोगों का हार्दिक अभिनंदन और इस वर्कशॉप में आपका स्वागत करता हूं. इसके पार्ट होने का, इस फैमिली का एक सदस्य होने के नाते ये मेरा कर्तव्य है कि जो लोग 7 समुंदर पार से आए, डॉक्टर यश, डॉक्टर दिवाकर और एक और हमारे साथी आने वाले थे जापान से, लेकिन वो अटक गए हैं, और तीसरा जो मुसाफिर है वो भटक गया है. तो मैं कभी भी एक्सपेक्ट कर सकता हूं, लेकिन उनका वो बहुत इंटरेस्टिंग थे सभी लोग जो नहीं आ पाए, और जो आए हैं उन्होंने अपना प्रदर्शन दिखा दिया. अब मुझे कुछ ऐसा समय मिला है कि जब पीछे वाले जो हैं वो गाना गा रहे हैं, आजा शाम होने आई, मौसम ने ली अंगड़ाई, तो किस बात की है लड़ाई. तो अब ये जाने का जब समय आता है मनुष्य का, और जो पोडियम से नॉट उस वाला, तो इस तरह के गाने याद आते हैं, क्योंकि सब लोग सुबह से लेकर एक प्राचीन साइंस से लेकर इस नए साइंस को जिसको कि अभी उन्होंने किया, तो मैं कुछ थोड़ा बहुत उसको जोड़ूंगा और आगे बढ़ूंगा। लेकिन मेरा my conversation, I want to keep it basically in the language which people understand. ये इसलिए है बच्चे लोगों कि कल और पहले भी मैंने आपके भविष्य के लिए कुछ लाइव सर्जरीज दिखाई। मेरा ये पर्पस रहता है कि आप में जब तक इस तरह के प्रोफेसर्स और टीचर्स जब आप देखते हैं, अनुराग सर तो उसको लीड कर ही रहे हैं आप लोगों को, तो ऐसा लगता है कि आप लोगों में इग्नाइटेड माइंड होना चाहिए। कल अब्दुल कलाम साहब की बर्थडे थी और मैंने पहला ऑपरेशन थिएटर आयुर्वेदिक इंस्टीट्यूट में इनॉग्रेट किया, जो आयुष यूनिवर्सिटी है, जहां पे मतलब आई फील वेरी लकी एंड प्रिविलेज कि जहां पे पहली 3 सर्जरी, वो सर्जरी आयुर्वेदिक साइंसेस के डॉक्टर्स कर रहे थे जो मुझे करनी, मतलब मैं करता है, ब्रेस्ट लंप था, फिस्टुला थी, तो मुझे बहुत अच्छा लगा। मेरे को लगा कि ये कहीं इंटीग्रेटेड साइंस का ये बहुत बड़ा लक्षण तो नहीं है। और सच में जिस दिन हम ये मान जाएंगे, प्रोफेसर साहब आप लोग सब लोग हैं यहाँ पे, बड़े मतलब ज्ञानी लोग तो हैं ही, और देखिए मेरी आदत है कुछ शेरो शायरी की और कुछ साधारण लैंग्वेज की। तो जीवन में और मृत्यु में सिर्फ जो आता है तो उसको बोलते जाने वाला है, तो जब जन्मता है तभी जाने का, लेकिन वो बीच में जो समय है वो अच्छा गुजरे, द क्वालिटी ऑफ लाइफ नॉट द इमोर्टैलिटी। बूढ़ा तो होना ही है सबको, इतना सब भाषण देने के बाद बहुत सारे बूढ़े लोग बैठे हुए हैं हमारे जैसे, तो ये तो समय की प्रक्रिया है। और समय की प्रक्रिया में हमेशा मैं ये कहता हूं, 1 और 1 2 हुए, 2 के बाद तीसरा, आगे आगे सब चले, न एक है न तीसरा। एक पुष्प खिल रहा है डाल पे गुमान से, तो एक कोई मिल रहा है धूलकर निदान से। एक कोई जा रहा है तो दूसरा कोई आ रहा है, एक कोई जा रहा है तो दूसरा कोई आ रहा है, कर रहा है पीछे पीछे इंतजार तीसरा। जीवन के इस नियम में जाना तो है ही, आए हैं तो जाना है, लेकिन क्वालिटी कैसे दें, तो इन सब प्रयासों से हम क्वालिटी दे रहे हैं। कोई रिसर्च करता है, कोई ये बताता है एआई है, और फिर इसी से थोड़ा सा आगे बढ़ते, चल रहा है नहीं, हेलो, तो मेरा यही आपसे अनुरोध है कि हम किसी को रोक नहीं सकते जाने से, लेकिन उसको हमेशा एक अच्छी जिंदगी देने के लिए जो ये ट्रीटमेंट है इंटीग्रेटेड मेडिसिन, जिसमें कि जैसा कि सुबह कोई somebody was telling that आपका किचन, आपकी मम्मी सबसे बेस्ट हॉस्पिटल है, राइट? मम्मी पिताजी जो भी घर में खाना बनाता हो, इट ऑल डिपेंड्स हु इज डोमिनेटिंग। कई बार अब आजकल लड़के लोगों को भी बनाना पड़ रहा है खाना, तो धीरे धीरे करके जो हमारा जो किचन है वो बंद होता जा रहा है। तो हमारा जो मेन हॉस्पिटल था वो अब जोमेटो को हमने सौंप दिया और हम पिज्जा खाने लग गए। जैसा कि डॉक्टर साहब ने बताया, ब्रेड ही बंद कर दी इन्होंने, इसीलिए इतना बढ़िया ये लोग मस्त रहते हैं। हम तो ब्रेड खा के हो गए आधे अधूरे। लेकिन ये इसका मतलब ये है कि हम जब भी अपने पुरातत्व या जो भी हमारी हिस्ट्री है, आर्काइव्स है, उसको छोड़ेंगे और भविष्य में जाएंगे तो कुछ ना कुछ हमसे छूटता जाएगा, और ये होता है। अब मेरा जो थोड़ा सा टॉपिक में मैं जस्ट फ्यूचरिस्टिक जो है, स्लाइड चेंज करते जाओ, ये नहीं हो रहा है, वहीं से करते जाओ, बोलूंगा जब। Then how do we kind of accelerate the future in coming age? Next slide please. अब ये सब चीजें
बहुत सारी बात हो गई यहाँ पे। कमल है यहाँ पे, सरिता है, और बहुत सारे लोग एआई पे अभी, जैसा कि आपके वीसी साहब ने भी कहा। तो हम नैनो टेक्नोलॉजी और बायोमेडिकल रिसर्च में, मेरा आप लोगों से सिर्फ एक ही अनुरोध है बच्चों लोग, कि आप रिसर्च में और एंटरप्रेन्योरशिप में डेवलप करो अपने आप को, और एक डॉक्टर न बन के आप एक समग्र इंसान बनो। The problem with majority of doctors all around the world is that they become only good doctors. They don't know. तो इसीलिए जब कभी भी बात होती है कि अरे यार तुम लोग तो बहुत पैसा कमा रहे हो, तो मैं हमेशा उनसे पूछता हूँ कि 500 लोगों की लिस्ट दे दो इस शहर में जिसमें डॉक्टर का नाम पहला हो, या डॉक्टर हो भी नहीं है। हाँ, वो जो काले धन का है वो तो हिसाब नहीं रख सकते, लेकिन हाँ सफेद धन का हिसाब में डॉक्टर नहीं आता कभी। तो इसका मतलब ये हुआ कि आप लोग एंटरप्रेन्योर नहीं बन रहे। एंटरप्रेन्योरशिप, डेवलपमेंट ऑफ बायोमेडिकल रिसर्च आर द मोस्ट इंपॉर्टेंट थिंग। नेक्स्ट स्लाइड। नाउ आपको सीखना पड़ेगा। अगर हम आर्टिफिशियल इंटेलिजेंस की बात कर रहे हैं तो इट इज नॉट जस्ट द चैट जीपीटी। I have created 3 studios of artificial intelligence in Gurgaon, where we have multiple cameras, where we have sound. मतलब आप एक बॉक्स में चले जाते हैं, जैसे आपने एयरपोर्ट में देखा होगा ना, ऐसे खड़े हो जाते हैं तो स्क्रीन हो जाता है फट से, उसी तरह का है। उसमें आपका सर्कुलर भी है और हॉरिजॉन्टल भी है। तो आपका पूरा स्क्रीनिंग हो जाएगा, आपके बायोएक्सियल का स्क्रीनिंग हो जाएगा, आपके फेशियल एक्सप्रेशन का स्क्रीनिंग, जैसा कि डॉक्टर साहब ने बताया कि कैसे हम पेशेंट से संवाद करें। आप तो एक लैंग्वेज दे दिया, लेकिन संवाद में क्या है, जो दरवाजे के उस तरफ है वो घबराया हुआ है, और जो दरवाजे के इस तरफ है वो डॉक्टर बैठा हुआ है, वो अपनी दादागिरी दिखा रहा है, ये करवाओ वो कराओ जांच कराओ। और जो बाहर बैठा हुआ है वो बोलता है डॉक्टर ये बहुत ही बदमाश है, सब पूरी जांचें करा ली, जबरदस्ती का फीवर आ रहा है मेरे पिताजी को, काय को जांच कर, 2 दिन का फीवर है। वो डिबेट एंड कॉन्फिडेंस में कॉन्फ्लिक्ट चलता रहेगा, चाहे वो आप आयुर्वेदिक डॉक्टर हो चाहे हो। लेकिन उसमें एआई का क्या रोल है, हम इसको भी रीड करें, हम अपने आप को भी रीड करें कि भाई 10 केसेस ऐसे आ रहे हैं, तो क्या मैं इनको छोटी सी कुछ दवाई देके ठीक कर सकता हूँ, उसको शहद और अदरक दे सकता हूँ। तो ये चीज की डिबेट अब चलेगी, आपके जीवन में भी चलेगी। आपको लगेगा कि मैंने आज 5 केस देखे, 10 केस देखे, उनको ट्रीट किया। नेक्स्ट स्लाइड प्लीज। अब जो डायग्नोसिस होगा आने वाले, बिकॉज सी हम लोगों का तो जीवन, हम तो नदी के उस किनार पहुंच गए, लेकिन आपको अभी नदी क्रॉस करनी है। आपने अभी जस्ट किनारे पे आए हो और नाव को रिपेयर कर रहे हो, उसके बाद नाव में बैठना है और जाना है, एक लंबा सफर है। तो जब आप लंबे सफर पे जाओगे तो तैयारी क्या क्या करनी पड़ेगी, तैयारी फ्यूचर की उस किनारे की करनी पड़ेगी। उस किनारे पे और बीच में जो लहरें हैं, जो साइंस है, उसकी अगर आप तैयारी नहीं करेंगे तो ये पढ़ाई व्यर्थ हो जाएगी। So you should be updated like what has been told by everyone. All of us, we try to teach you कि नई चीज सीखने की उत्सुकता आप में होनी चाहिए, और उसी चीज को मैं शायद हमेशा कोशिश करता हूँ कि बच्चे लोगों को ये बताऊं कि जो पीछे जो बैठा हुआ है वो गाना सिर्फ और ताता थैया ना करे। जो इंस्टा पे आजकल चलता है ना, 5 लड़कियां ऐसे और वैसे डांस करती, अच्छा बोला मैंने? Yes, how happy they are also doing it. ये लोग कुछ और दूसरे मेथड से करते हैं, लेकिन करते जरूर। लेकिन एनीवे, तो हमको अब डायग्नोस्टिक टेस्ट जो हैं, जो बैकमैन कुल्टर की मशीन आती है, करीब 5 करोड़ की आती है, हमारे अस्पताल में है लकीडी इन सतना मध्य प्रदेश। तो उस मशीन में 400 टेस्ट 8 मिनट में हो जाते। अब वो जमाना गया कि कल आना आप, अब पैथोलॉजी घर में पहुंच गई। और किसी ने मेरे को ये बोला कि रिप्लेस नहीं कर सकते, जैसे डॉक्टर तोमर ने बोला। मैं आपको बताना चाहता हूं डॉक्टर साहब, रोबोट ने रिप्लेस कर दिया डॉक्टर जो बोलते थे मैं आ नहीं पा रहा हूं। आर्टिफिशियल इंटेलिजेंस ने रिप्लेस कर दिया बहुत सारी चीजों को, और अपनी टेक्नोलॉजी ने, जो मोबाइल पे जब हम अपने गांव जाते थे तो एक ट्रेन दूसरी ट्रेन बदलते थे, अब वीडियो कॉन्फ्रेंसिंग पे मदर से बात करिए, हो गया आपका रिप्लेसमेंट, ट्रेन खत्म। और होगा जब नैनो टेक्नोलॉजी आ जाएगी, जब माइक्रो रोबोट्स आ जाएंगे, जब कैप्सूल एंडोस्कोपी हम पूरी आंत को देख सकते हैं, तो हमारे लंबे लंबे एंडोस्कोप मोटे मोटे जो डाया वाले हैं वो गायब हुए। और होगा जब हम छोटे छोटे रोबोट को पेट के अंदर डाल देंगे थ्रू ट्रोकर, और वो जाके सर्जरी वर्जरी करके वापस आ जाएगा, उसको धागे से खींच लेंगे तो आ जाएगा। ये होने वाला है आपके लिए, आपको तैयार रहना पड़ेगा। आई एम नॉट जोकिंग, यू सीन ना पैथोलॉजी। अब वो छोटे छोटे बाबू पैथोलॉजी, दारू पैथोलॉजी, ये पैथोलॉजी सब गायब हो गए, अब सिर्फ बड़े बड़े पैथोलॉजिस्ट आ गए। दे टेक योर सैंपल फ्रॉम होम, दे डिलीवर इट योर होम। आपके ड्रोन्स आ गए जो आपको सामान दे रहे हैं घर पे जाके, गेहूं चावल सिंचाई, किसान के लिए खाद, और आपके लिए दवाई। नॉर्थ ईस्ट में हम लोगों ने बहुत अच्छा एक प्रोजेक्ट लिया जिसमें दवाई घर पे डिलीवर, रेडियोलॉजी घर पे डिलीवर हो रही है। रेडियोलॉजी आपका एक्सरे हम घर पे खींचेंगे, मोबाइल वैन आ गए। तो कहाँ कहाँ हम जाएंगे, मतलब कितनी सारी चेंजेस आएंगे। और उस चेंजेस में एक चीज जो कॉमन रहेगी, नेक्स्ट स्लाइड प्लीज। ऑफ कोर्स ये तो बहुत कॉमन हो गया कि इमेजेस को हम पढ़ सकते हैं, इमेजेस का इंटरप्रिटेशन कर सकते हैं। हम एक डेटा जिसकी बात कर रहे थे, बिग डेटा, तो डेटा से हम एनालाइज करके हम मॉडल्स बना सकते हैं कि इस क्षेत्र में गोरखपुर में मेनिंजाइटिस के इतने सारे केसेस थे और उस केसेस को इस तरह से ट्रीट किया गया, कहाँ का पानी कंटेमिनेटेड था, पूरा वी कैन सी इट ऑल वेरी नाइसली टोपोग्राफिकली, एंड वी कैन इरेडिकेट डिजीजेस। ट्यूबरकुलोसिस पे हम लोग बहुत अच्छा काम कर रहे हैं रेडियोलॉजी में, मैलिग्नेंसी में बहुत अच्छा काम हो रहा है, और बेसिकली नाउ मोस्ट ऑफ द थिंग्स आर quite connected with high speed internet data through satellite, so things are very easy. And then next slide please. अब मास स्क्रीनिंग है, क्योंकि 140 अभी हैं, तुम लोग जब बड़े होगे तो 170 हो जाएंगे, 170 करोड़। तो 170 करोड़ के लिए कितने सारे डॉक्टर्स लगेंगे, क्या ये पॉसिबल है? नहीं। तो फिर उसमें एआई आएगा, उसमें एनालिटिक्स आएगा, उसमें डेमोग्राफिक पैटर्न्स आएंगे। तो ये चीज होने वाली है। और अपनी कंट्री और चाइना जैसी, जहां पे कि बच्चे पैदा होते ही जा रहे हैं, और संदेश हमारे लोगों के द्वारा ये है कि आप बच्चे कम करेंगे तो स्वीडन बन जाएंगे, कम करेंगे तो ग्रीस बन जाएंगे, वहां पॉपुलेशन कम हो रही है, और ज्यादा बढ़ गए तो फिर अपन लोग है ही हैं इधर, पूरे इतने सारे भर गए एक साथ, और अभी जा भी नहीं रहा है कोई। मेरे को तो लगा था मेरा जब तक लेक्चर आएगा अनुराग सर बोलेंगे कि बस अपन दोनों ही बैठे हैं, अब किसको बोल रहे हो आप, तो इस तरफ मुंह करके बोलो। तो अभी तक आप लोग रुके हो, थैंक यू सो मच यार। नेक्स्ट स्लाइड प्लीज। Of course, precision therapy and all that, drug dosed onto nanoparticles smeared दवाइयाँ, the immunoglobulins, CAR T therapies सब आती जा रही है। और मुझे तो पता नहीं, मैं जब सुबह सुबह उठ के जल्दी पढ़ता हूँ, डॉक्टर साहब से ही सीखा है हम लोगों ने कि सुबह जल्दी पढ़ लेने से थोड़ा दिमाग में कुछ रह जाता है, नहीं तो बाकी फिर बादाम खाना पड़ता है। बादाम से कुछ होता जाता नहीं, बहुत खाया है हमने बादाम, होता है क्या कुछ? आप बताइए। और महंगाई में बादाम खाओ तो और प्रॉब्लम है, सब भूल जाता है। डॉक्टर साहब बोल रहे हैं उससे आईसाइट बहुत अच्छी होती है, तो भाई हाँ 5 बादाम रोज, ठीक है भाई। अब आगे की स्लाइड जल्दी से, मैं आपको रोबोटिक्स इसके बारे में बता दिया। आगे की स्लाइड प्लीज। नैनो टेक्नोलॉजी एंड सर्जिकल मॉलिक्यूलर टेक लेवल पे ही हम लोग मॉलिक्यूल पे ही सर्जरी करेंगे। हम टारगेटेड थेरेपी दे रहे हैं। लंग्स वी हैव कॉन्कर्ड, ovary we have conquered, breast we have conquered. I'm telling you, chronic myeloid leukemia we have conquered. So there are malignancies which have, like from my science what I'm talking, but yeah, integrated science जब रहेगा तो हम जैसे उसको न्यूट्रिशन देना है, हम उसको सपोर्टिव इम्यूनो मॉड्यूलेशन करना है। बहुत सारी वेदांत साहब और तोमर साहब, ये लोग सब लोग बैठे हुए यहाँ पे, बहुत हाई फैकल्टी जो इसमें काम कर रही है। और निमैंस का जो अभी हम लोग डिस्कस कर रहे थे चाय पे, कि इतना इतना बढ़िया काम कर रहे हैं लोग, एंड सो मच ऑफ रिसर्च दे हैव डन, एंड बीइंग फ्रॉम कर्नाटका आई एम सो प्राउड ऑफ पीपल फ्रॉम निमैंस. It is one of the prestigious institute of this country or probably of the world, and I must congratulate for your lot of presentations and lot of publications. Thank you so much. Next slide, please. आगे का ऑर्गन बाय ऑर्गन एवरीथिंग विल बी नाउ स्पेसिफिक. अभी तो कुछ ही स्पेशलिटी हम लोग आज से 40-42 साल पहले सर्जरी करी थी तो सब करते थे, तो बड़े सर्जन कहलाते थे. जो जितनी सर्जरी कर ले बड़ी वाली तो बड़ा सर्जन कहलाता था, और जो छोटे सर्जन होते थे वो डांट खाते थे सिर्फ. तो हम लोगों ने डॉक्टर साहब की खूब डांट, सही है डांट खाएं, मतलब मैंने डायरेक्टली नहीं, लेकिन हाँ, क्योंकि अगर आप पढ़ेंगे नहीं, इसीलिए एम्स बना, इसीलिए महर्षि योगी इंस्टीट्यूट में हम लोग इस तरह की वर्कशॉप करना चाहते हैं, इस तरह की आपको सर्जरी दिखाना चाहते हैं कि आप लोग अच्छे बने, आप लोगों में इग्नाइटेड माइंड हो, आप लोग कुछ सोचने के लिए कुछ करें. नेक्स्ट स्लाइड प्लीज. ये मैंने बोला था आपको कि ये जर्नी है, तो इस पे 1-2 कविता सुना के मैं अपना ज्ञान बंद करूंगा, अगर ज्ञान है तो. कैंसर के बारे में 2 लाइनें हैं, डॉक्टर साहब आपको समर्पित है. कैंसर और भगवान कृष्ण का मुंह खोलना. मैं ऐसे एमालगमेशन बहुत करता हूं, तो जब बोला कि कान्हा मुंह खोल के दिखा, तूने मिट्टी खाई है क्या? तो बोला नहीं माँ, मैंने नहीं खाई मिट्टी. तो बोले कान्हा तू झूठ बोल रहा है. तो उसने बोला कि अगर मैं मुंह खोलूंगा तो आपका एग्जिस्टेंस खत्म हो जाएगा माता. तो बोली नहीं, खोल के दिखा. तो उसने जब मुंह खोला कृष्ण ने, तो ब्रह्मांड दिख गया. ऐसे जो कथाएं हैं लोक कथा में, तो उसका मतलब क्या हुआ, उसका मदर का एग्जिस्टेंस ही कर. बोले नहीं, तू मेरा कान्हा नहीं है. शी टोल्ड दैट. तो जब आप कभी बड़े डॉक्टर बन जाओगे और आपके पास आपकी माँ के लिए या अपने भाई के लिए, अपनी बहन के लिए, छोटे परिवार में कोई है माता पिता के अलावा, तो उनके लिए अगर टाइम नहीं लगेगा, तब कवि की 1-2 लाइन है जो कैंसर में फिट होती है. कैंसर भी जब मुंह खोलता है तो फिर पहली बार पता चलता है, न मैं रंग हूं न रूप हूं, न मैं रंग हूं न रूप हूं, न प्रायण किसी आकार का, जो दिखता वो मैं नहीं, फिर प्रश्न क्या अधिकार का. कैंसर पूछ रहा है आपसे, न मैं रंग हूं न रूप हूं न प्रायण. इतना सा छोटा सा कैंसर, लंग में मेटास्टेटिक डिजीज, आप तो सोच ही नहीं सकते. पहले तो जब हमारे पास पैट ही नहीं था, जब हमारे पास सीटी स्कैन नहीं था, तब बड़े बड़े डॉक्टर यश गुप्ता सर्जरी कर देते थे. आज वो नहीं कर पाएंगे, क्योंकि आप वो पहले ही बोल रहे हैं साहब यहाँ पे तो ऑलरेडी है, पहले प्री कीमोथेरेपी लगानी पड़ेगी. तब कैंसर, तब कान्हा, तब यशोदा, तब नंद, सभी ये गाना गाते हैं. जब डॉक्टर भी ये गाना गाता है, न मैं रंग हूं न रूप हूं न प्रायण किसी आकार का, जो दिखता वो मैं नहीं, फिर प्रश्न क्या अधिकार का. क्यों निज को संकुचित करूं जो रूप है विस्तार का, क्यों निज को संकुचित करूं जो रूप है विस्तार का, जो दिखता वो मैं नहीं, फिर प्रश्न क्या अधिकार का. मैं तो अपने आप को छोटे से रूप में लाया हूं, लेकिन मेरा विस्तार बहुत बड़ा. ये सेम प्रभु ने अर्जुन को बोला 1860, अब तू मेरे में समा जा, योर टाइम इज ओवर टू बी एक्सप्लेन. 1866 में बोला अब तू जस्ट इन मी, ट्रस्ट इन मी. तो वही डॉक्टर भी बोलता है, वही आप लोग बोलोगे पेशेंट को, क्या क्वेश्चन पूछता रहता है, इतनी सारी थैलियां लेके घूम रहा है, अभी भी पेट में दर्द है. तो ट्रस्ट इन सम डॉक्टर ना, ट्रस्ट तो करेगा कि नहीं करेगा. किसी भी साइंस में चला जाए, ट्रस्ट कर, एंड दैट इज व्हाट इट हैपेंस. तो इस के साथ मैं सिर्फ यही बोलना चाहता हूं आप लोगों को कि जब कभी भी कोई भी मौका मिले, नेक्स्ट स्लाइड प्लीज जल्दी से. मैं दिखाना चाहता हूं वो जो 66 केजी जो आवाज की गूंजों में पीछे परेशान बच्चों में जल्दी घर जाने की आवाज में दब गया. नेक्स्ट स्लाइड प्लीज. ये वो अस्पताल था जब मैं आया था 35 साल पहले, पहला ब्लॉक था. नेक्स्ट स्लाइड प्लीज. नेक्स्ट स्लाइड. अभी ये इस तरह से, तो आपको संरक्षक करना पड़ेगा. 3 लाख पेड़ हम लोगों ने लगाए और उनको बच्चे जैसा पाला है. हर पेड़ में मेरे पसीने की खुशबू है. और मेरा जीवन सार्थक जब होगा जब हमारे पसीने की, डॉक्टर अनुराग के, डॉक्टर यश के पसीने की खुशबू आप में से आए। ये मेरा दिल की मेरी इच्छा है। वेदांत साहब की, तोमर साहब, सब लोग बैठे हुए हैं। हम लोग क्या चाहते हैं? हम लोग तो पहुंच गए, हम तो पहुंच गए, अच्छे शर्ट पैंट मिल गए हमको, गाड़ियां भी ठीक ठाक है, लेकिन तुम लोगों को अचीव करना है। नाउ द बेटन हैज टू बी पास टू यू। नेक्स्ट स्लाइड प्लीज। नेक्स्ट स्लाइड। दिस इज द हॉस्पिटल वेयर आई वर्क, और इसका लोगो ही है त्वदीयम वस्तु गोविंदम तुभ्यमेव समर्पये। फ्रॉम गॉड वी रिसीव, टू गॉड वी हैव टू ऑफर इट बैक। और इस मौके पे मैं माननीय चांसलर साहब, हमारे अग्रज और हमारे मार्गदर्शक माननीय योगी जी का तहे दिल से मैं मानता हूं कि भगवान कभी दूसरे रूप में आते हैं, तो कभी मोदी बन के आएंगे, कभी योगी बन के आएंगे, कभी आप जैसे बच्चों में आएंगे। और कहानी को, क्योंकि मेरा समय मैंने ज्यादा तो नहीं लिया, लेकिन हाँ मेरे को ये लगता है कि उस माँ को, नेक्स्ट स्लाइड प्लीज, नेक्स्ट स्लाइड प्लीज, नेक्स्ट स्लाइड, करते जाओ, नेक्स्ट स्लाइड, नेक्स्ट स्लाइड, नेक्स्ट, दिस वाज, नेक्स्ट स्लाइड प्लीज, नेक्स्ट स्लाइड, नेक्स्ट स्लाइड। ये निर्माण हमारे यहाँ जो कैंसर यूनिट का मैंने क्या, ये अहम और ईगो वाला महल नहीं है, मतलब हम लोग थे इसमें साथ में। नेक्स्ट स्लाइड प्लीज। This is the construction which we made. Next slide, please. This is Atria, which is a beautiful cancer unit which we have created. Next slide, please. Next slide, please. और फिर foreign से, this is Brit South Nikivan. Next slide, please. Next slide. This is my chairman. Next slide, please. I used to be young then. Still I am young. Next slide, please. This is the first man who was treated on linear accelerator in the world. तो मेरा आपसे एक और अनुरोध है, जैसा कि किसी ने भी पहले भी बोला था, कि जो भी काम आप कर रहे हैं उसको डॉक्यूमेंट करिए, लिखिए, उसके फोटो खींचिए। उस लड़की का जिसका कि पहली सर्जरी हुई है ब्रेस्ट लंप की इस आयुष के इतने बड़े अस्पताल में कल, उसका हमने फोटो लिया है। और जो आज डिस्चार्ज हुई है गॉल ब्लैडर, जिसका हमने कल सर्जरी किया था, उसका फोटो लिया कि you will be remembered as the first patient who gave confidence to us to do the surgery on you। क्योंकि आदमी आपके पास आता है, और पेशेंट आपके पास आता है, अपने शरीर को देता है कि डॉक्टर साहब आप दवाई दे सकते हो मुझे, आप ऑपरेशन कर सकते हो, तो ट्रीट देम एज योर ओन रिलेटिव्स, राइट। दिस इज द कैरी होम मैसेज आई एम टेलिंग। वर्कशॉप में बहुत सारी बातें होती है, लेकिन पेशेंट से रिलेटेड इस बात को मैं रखना चाहता हूँ। ये मेरा जीवन का सार है, हम सभी लोगों का सार है। अगर आप उससे अच्छी तरह से बात नहीं करेंगे, आप उसकी केयर नहीं करेंगे, तो मैं बता रहा हूँ, आप कितने ही बड़े, कितने ही गोल्ड मेडल लेके जी लो, लेकिन आपके पास पेशेंट नहीं आएगा। और आएगा भी तो जबरदस्ती जाएगा, बोले डॉक्टर बहुत खड़ूस है, लेकिन जाना पड़ रहा है यार, कोई है ही नहीं और दूसरा। नेक्स्ट स्लाइड प्लीज। नेक्स्ट स्लाइड, नेक्स्ट स्लाइड, नेक्स्ट। हम लोग ये बड़े छोटे छोटे ट्यूमर्स, मतलब छोटे बच्चे में बड़े बड़े ट्यूमर्स निकालते हैं। दिस माय टीम। नेक्स्ट स्लाइड प्लीज। और बहुत एजुकेशनल प्रोग्राम्स करने में, स्किल डेवलपमेंट प्रोग्राम करने में मेरा एक विशेष इंटरेस्ट है। नेक्स्ट स्लाइड प्लीज। नेक्स्ट स्लाइड। दिस आर टाइप ऑफ ट्यूमर्स व्हिच यू गेट रैप्टोमा, ह्यूज विम्स ट्यूमर विथ केवा ऑब्स्ट्रक्शन। नेक्स्ट स्लाइड प्लीज। ये इस तरह के कई बार प्रोसेसेस निकलते हुए बाहर झांकते हुए नजर आते हैं, और बड़ा आराम से ये आदमी जीता भी है। नेक्स्ट स्लाइड प्लीज। एक जीने का उदाहरण मैं आपको दूंगा। नेक्स्ट स्लाइड प्लीज। नेक्स्ट स्लाइड, नेक्स्ट स्लाइड। ये सब मतलब ये घिस घिस के थायराइड। नेक्स्ट स्लाइड प्लीज। ये वाला जो ट्यूमर था, दिस वेंट इनटू गिनीज रिकॉर्ड्स। वी रिमूव्ड 66 kg tumor in this lady. This was about 80 centimeter dia, which is normally about 11 to xiphoid to this. She was with the tumor, she was 101 kg, without tumor 35 kg. Next slide, please. ये चीज चाहिए हमको। उसने 6 साल के बाद ये इस तरह से उसने, इसमें मेरे पास करीब 3,80,000 लाइव रिकॉर्डेड सर्जरी है। मेरे को थोड़ा सा फोटोग्राफी में भी इंटरेस्ट है, लेकिन मैं ये बताना चाहता हूँ कि जो भी काम करो आप उसको रिकॉर्ड करो, डेटा रिकॉर्ड होना चाहिए। नेक्स्ट स्लाइड प्लीज। और ये वो बच्चे हैं जो पन्नी गोबर कचरा जमा करते थे, इनको हम लोगों ने हेल्थ केयर में डेवलप किया है। दे असिस्ट इन माय सर्जरी एंड इनफैक्ट दे डू लॉट ऑफ स्टेप्स ऑफ माय सर्जरी। 7,800 बच्चों को ट्रेन किया है जो 2 रुपए कमाते थे, और अभी पिट्सबर्ग में हमारे 4 बच्चे। नेक्स्ट स्लाइड प्लीज। अब जस्ट बताना चाह रहा हूं, उनको सेलिब्रेट कराते। नेक्स्ट स्लाइड प्लीज। ये इस तरह से। नेक्स्ट स्लाइड प्लीज। और ये बिट्स पिलानी हैदराबाद में ये तीनों बच्चे हमारे गए जीनोम सीक्वेंसिंग में काम कर रहे हैं। 12वीं पास बच्चे हैं ये, और इनकी कहानी आप सुन सकते हैं क्योंकि मैं टाइम वेस्ट। नेक्स्ट स्लाइड प्लीज। इनकी हंसी देख रहे हैं, ये लोग पहली बार ट्रेन में बैठे थे। आई एम टेलिंग यू, आर प्रिविलेज्ड यार, यू आर वेरी मच प्रिविलेज्ड। तो इस समय को बर्बाद मत करना तुम लोग, क्योंकि मुझे सबसे ज्यादा दुख होता है जब आदमी पढ़ाई के टाइम पे समय बर्बाद करता है। हम लोग आज भी, डॉक्टर साहब 70 के होने वाले हैं, वहां पे डॉक्टर साहब 74-75 के बैठे हुए हैं, और यहाँ पे भी डॉक्टर साहब बैठे हुए हैं जो 77 के ऊपर के होंगे, और अभी भी इंटरेस्टेड हैं आपको पढ़ाने में, अभी भी आ रहे हो। तो इसका मतलब क्या हुआ, आप इतने सारे लोगों का एक्सपीरियंस अगर जोड़ेंगे तो हमारे कितने हजार साल हो जाएंगे जो हम आपको पढ़ाने आ गए इधर। मेरे 70, इनके 70, इनके 70, उसके इसके मिलाते रहोगे तो आप तो कितना आपको ज्ञान मिल रहा है। तो अब उसमें जो पीछे वाले जो बैठे हैं उनके लिए अब शाम हो गई है, तो वही गाना आजा शाम होने आई, तो आप अंगड़ाई ले सकते हैं, और फिर हम लड़ाई ना करके आपसे हम दोस्ती करेंगे। आपको जब कभी भी मौका मिलेगा हम आएंगे। और आज यहाँ पर मुझे इस मौके पे बोलने का आप लोगों ने जो समय दिया, मैं अनुराग सर का हृदय से नमन करता हूँ। ऐसे टीचर जो अलाउ भी कर देते हैं ग्रेस मार्क्स, ग्रेस मार्क दे दिए, बोले चलो आज बोलने दो यार, संजय को बोलने दो। थैंक यू सो मच, एंड आई थैंक वीसी साहब, हमारे रजिस्ट्रार साहब, और ऑल द पीपल दोज हु हैव कम फ्रॉम ऑल ओवर। आई रियली थैंक यू। एंड जो ऑर्गेनाइजर्स हैं, विधान साहब की और प्रिंसिपल साहब की और डीन की, आप लोगों ने बहुत मेहनत करी है, बहुत अच्छा प्रोग्राम किया है। वी आर थैंकफुल टू यू। थैंक यू किड्स फॉर doing all the lateral arrangements. Thank you.
Thank you very much, sir, for joining us and sharing your valuable insights. Finally, I invite our chairperson, Dr. Anurag Srivastava, sir, to the stage for his valuable remarks on the representative sessions.
नमस्कार। आप लोगों ने काफी ज्ञान प्राप्त कर लिया है और शाम हो गई है। आजा शाम होने आई गाना भी सुन लिया है। तो और कोई प्रश्न पूछना हो आपको, कोई क्वेश्चन है किसी भी स्पीकर से, या कुछ अपना कोई आइडिया हो? हाँ, डॉक्टर तोमर साहब जी। सर को माइक, अच्छा यहाँ पे सर आइए। डॉक्टर तोमर हमारे विजिटिंग फिजिशियन हैं और बहुत ही ज्ञानी हैं, और जी हमेशा।
आज इस मंच पर मैं तमाम महर्षियों को देख रहा हूँ। आज के युग के सुश्रुतों को बहुत जोरदार तालियों से अभिनंदन करिए। और मित्रों, एक चीज ध्यान में रखिएगा, एक चिकित्सक होने के नाते एक चीज आपको कहना चाहता हूं कि लोग कहते हैं, आयुर्वेद के चिकित्सकों की बात मैं कर रहा हूं, कि वो पेशेंट हमारे पास आया रिफ्रैक्टरी फॉर ऑल मेडिकल ट्रीटमेंट और हमने उसको क्योर कर दिया। माय डियर फ्रेंड्स, रिमेंबर दिस थिंग। चरक हैज क्लियरली मेंशन्ड, नित सर्वे व्याधया भवन्ति उपासाध्या, नित सर्वे उपासाध्यानां व्याधिनां अनुपाय निषिद्धस्ति, परीक्षा कारण कुशला भवन्ति। We cannot treat each and everybody. There are certain disorders which are incurable. Remember this thing. What you can contribute, that is very important thing. In the patient of cancer, what Ayurveda can contribute, we can definitely add some more precious days, months and years in the life of the patient. And we can definitely improve quality of life with the integrated approach. And third one is that we can minimize the side effect of the chemotherapy and radiation therapy. तो इन सब महर्षियों को पुनः प्रणाम करते हुए बहुत बहुत धन्यवाद देता हूं। अभी आपको चरक के इंस्ट्रूमेंट्स के बारे में कहा, यंत्र सतमेव कोत्रम मत हस्तमेव प्रधानतम यंत्राणाम अवगच्छ, तत्र चतुर्विंशति स्वास्थ्य यंत्राणि द्वय विंशति नाड्या अष्टाविंशति शलाका पंचविंशति उपयंत्राणि चेति। Such types of the description is available. No science can replace the basic principles of the instrument of Sushruta. That is a wonderful approach. Give a big hand to Sushruta. Jai Ayurveda.
Thank you very much, sir, for being a part of this important scientific discussion.
Thank you. Thank you.
Now, thanking all the respected dignitaries for enriching this session and for all the insightful presentations we have witnessed today. Now, it is time to honor and express our heartfelt gratitude to the distinguished resource persons who have shared their valuable knowledge and contributed immensely to the success of this scientific session.
Dr. Yash Gupta wants to present his book to Professor Principal Vedantam, sir. Thank you, Dr. Yash Gupta.
Thank you so much, sir. Now, now to carry out this movement of appreciation and felicitation, I would now like to respectfully invite our dignitaries on stage. I request our Honorable Chairperson, Dr. Anurag Srivastava, sir, for felicitating the resource persons with their very deserved memento of honor. First up, I request Dr. Divakar, sir, to please come upon the stage. Now I request Dr. Yash Gupta, sir, to please come forward. Now I request Dr. Naveen Kumar Singh, sir, to please come forward. Now I request Dr. Sanjay Maheshwari, sir, to join us. Now I respectfully invite our coordinator for this session, Dr. Priya Nayan ma'am, for felicitating our chairperson, Dr. Anurag Srivastava, sir, co-chairperson, Dr. Sandhya Pathak ma'am. Yes, ma'am. मम वो अभी आएगा नहीं नहीं यहाँ से यहाँ तक कहाँ से
तज ज्ञानम विधि सात्विकम। जो हमारे अंदर जो आत्मा है वही आपके अंदर है। ईश्वर सर्वभूतानां हृतदेशे अर्जुन तिष्ठति भ्राम्यन् सर्वभूतानि अंतरोण। कई जगह भगवान ने बोला है, और सबसे अच्छा बोला है चैप्टर 15 श्लोक 15 में भगवत गीता में। उसको मेरे गुरुजी ने गा के सुनाया, इसलिए गा के बताऊंगा। सर्वस्य चाहम हृदि सन्निविष्टो मत्तः स्मृतिर ज्ञानमपोहनम च वेदैश्च सर्वैरहमेव वेद्यो वेदांत कृत वेद विदेव चाहम। सभी के हृदय में मैं स्थित हूँ, उसी मुझसे ही स्मृति ली है और मुझसे ही अपोहनम। जो जैसे सर एक कंप्यूटर में जब मेमोरी बहुत भर जाती है तो उसमें मैसेज आता है यू कांट सेव योर फाइल, डिलीट सम फाइल्स। तो डू यू रिमेंबर योर रोल नंबर इन केजी किंडरगार्टन? नो, you don't need it. So lot of memory which is unnecessary, God is also giving you the memory smriti and also deleting which is unnecessary. And he is the author of the Vedas, and the knowledge to be obtained by learning the Vedas, he is the author. तो बहुत अच्छा है। तो हम में और आप में कोई अंतर नहीं।
Now I request Dr. Anurag Srivastava sir to kindly facilitate our coordinator for the session, Dr. Priya Nayan ma'am.
एक मैं भी सुना रहा हूँ, एक क्विक वन। सर्वे भवन्तु सुखिना, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्। हे नाथ सब सुखी हो, कोई न हो दुखारी, सब हो निरोगी भगवन, धन धान्य के भंडारी। सब भद्र भाव देखें, सन्मार्ग के पथिक हो, दुखिया न कोई होवे, सृष्टि में प्राणधारी।